So you've searched for a private hearing test in London. You're in the right place. But before you book anywhere, including here, it's worth spending at least 2 minutes of your time understanding what most hearing tests actually measure and what none of them measure until now. So my name is Awajimijana Otana. I'm one of the audiologists here at Verified Hearing and Tinnitus Clinic. So a standard hearing test anywhere in London, so in the NHS or privately, does one thing. It measures the quietest sounds you can detect at specific frequencies in a quiet booth. It gives you a graph called an audiogram. It shows where your hearing drops off, and it tells your audiologist whether you might benefit from hearing aids or not. That is a useful thing to know, but it is not the full picture, because hearing is not just about detecting sound. It's about what the brain does with the sound once it receives it. So how it separates speech from background noise, how quickly it processes what it hears, how much cognitive effort hearing is costing you every day. The standard test measures the ear. It tells us nothing about any of that. So nothing about how your brain actually decodes speech. The brain-based hearing assessment, however, goes further. Along the standard components you'd usually get, like the audiogram, the bone conduction test, the middle ear function test, like tympanometry, we also test speech discrimination, so speech and noise, and we assess the central auditory process and picture, how your auditory cortex is actually decoding what it receives, which is why patients sometimes come to us after a normal hearing test elsewhere and leave understanding for the first time why conversations in restaurants are exhausting, why they miss words even in quiet rooms, why the audiogram said it's fine, but the experience doesn't feel fine at all of hearing. The assessment takes 60 to 90 minutes. At the end of it, you receive a full written clinical report the same day. Not just a graph or not just a recommendation saying, you must come back and try hearing aids. A complete clinical map of your hearing system, both the peripheral function and the brain processing, with a clear, honest explanation of exactly what is happening and what, if anything, would actually help. So we're at Harley Street and on Wigmore Street, and no GP referral is required for the brain hearing assessment. Most hearing tests answer one question: do you have a hearing loss? This one answers the question that actually matters. Why are you struggling with hearing? And what does your complete hearing system look like? That is the difference. Click the button below to book an appointment, and we're looking forward to welcoming you to Verified Hearing. Thank you.